Let's bring it closer to home here in Alberta and the issues that I hear about all the time. And I know people have taken up with you personally on your show. First and foremost is healthcare. So where are we with healthcare?
We made some great progress in those first few months. We reduced the amount of wait time in emergency rooms by 17%. We were reducing the amount of surgical waits by 1,000 a month. We were also eliminated red alerts. And then the election happened, and we came back, and we found that things had regressed. And one of the things I'm greatly disappointed about is one of the mandates that I gave to Alberta Health Services is we know, like clockwork, every year we get into a fall respiratory virus season. We need to increase ICU capacity. We need to make sure that we've got acute care capacity. And once again, they failed. I've been watching this very closely because back in April of 2020, we had 295 acute care beds, and there was a plan to increase it to 1,000. Where are we today? 223 ICU beds. And that's the real problem, is that we have the ability to manage patients when they come in, but we have a healthcare system that continues to underperform. And so we've made some new changes, and I'm not going to take no for an answer, because we need to make sure that we get our ICU capacity up. We have to have enough acute care beds to ensure that we've got places for people with our growing population. We need to eliminate surgical backlogs. We also need to make sure that we're not causing our ambulances and our highly trained paramedics to sit on park for hours and hours on end. And we have to make sure everyone has a family practitioner. So those are the non-negotiables for me. And I think people should now see that I'm serious about it. We eliminated the original Alberta Health Services Board. I put in an official administrator. We didn't make enough progress. We've got a new board in place. We've got a new chair. We've got a new CEO, and we're going to make real progress. We have to. We have watched this system deteriorate ever since the single health super board came in 2008.
Yeah.
And we've watched premier after premier, health minister after health minister just defer, say there's nothing we can do, give them more money.
Yep.
We trust AHS. And I've said, no, I don't. I'm tired of the snow job. I'm tired of being told, just trust us, we got this, when we don't. The more money we give, the worse of a performance. So I would say I wished I'd been able to make a lot more enduring progress in the first year. We'll try a bunch of things, and we're going to make it work. We have to. It's the number one cost item that taxpayers are paying for. They deserve to have the very best system, and we have to deliver it.